Hi everyone, and thank you for attending this presentation. My name is Stephen Hall, and I'm a registered nurse and Master of Nursing student at the University of Saskatchewan. Today I will be presenting the pilot project to my thesis work entitled Assessing the Need for Caregiver Support in Saskatchewan, Gathering Perspectives and Setting Priorities. As the caregiver experience affects so many Canadians, it warrants considerable attention in research, policy, and practice. As described in the abstract for this presentation, our objective was to engage Saskatchewan caregivers in setting priorities for accessible support interventions. Results from an environmental scan are viewable on the poster. As you can see, there is still much room for growth in Saskatchewan in terms of supporting caregivers in their role. Therefore, our research question was, what do the experiences of caregivers have to offer in setting priorities for caregiver support in Saskatchewan? We held 2 focus groups and had a total of 33 participants who were caregivers to older adults. 4 themes emerged from our data, and participant recommendations are viewable on the poster as well. Caregivers in our focus groups were eager to share their experiences in group discussion. Lack of access to information, financial support, and respite was prevalent. Conflict was another central topic within our group discussion, in both the context of conflict with self and conflict with others. Caregivers spoke about bearing the full burden, neglecting self-care, and feeling overwhelmed, as well as the added stress for their own declining health. Participants provided key insight on what supportive interventions they would be interested in accessing and benefiting from. In fact, many of the participants' recommendations have already been validated as supportive interventions for caregivers. With respect to our first theme, 2 noteworthy points were the lack of access to finances and transportation. Many caregivers have to absorb the costs associated with medical services, supplies, medications, and transportation for the care recipient. Furthermore, support provided by caregivers can range from a few hours a week to round-the-clock care, which can be detrimental in maintaining employment and steady financial income. In a previous Saskatchewan study, 22.7% of caregivers reported spending roughly half an hour to 10 hours per week performing unpaid caregiving work. However, the same study found that rural Saskatchewan caregivers are more likely to be spending over 40 hours a week on unpaid caregiving activities. Moreover, those who live in rural areas have less access to healthcare professionals, additional care services, and respite. This means they need to find transportation into urban centers for assistance, which highlights the need to explore the needs, perspectives, and experiences of rural Saskatchewan caregivers in future studies. Some of our participants noted the difficulties and feelings of isolation that they experienced when not receiving support from family members. Other studies have reported similar findings, where family members and friends who are not as present as the primary caregiver have a different experience with the care recipient, which can lead to disbelief and conflict. This disbelief on the part of those who are external to the primary caregiving scenario is detrimental and can further add to the burden of caregiving and worsening health outcomes for the primary caregiver. Balancing the needs of the care recipient with those of the caregiver was also reported to be difficult for caregivers in our study. Caregivers can sometimes be invisible patients, meaning their health and wellness is overlooked by providers as the focus is on the care recipient. Of note, spousal caregivers are at a higher risk of declining health because of deprioritizing their own self-care to be able to support their spouse in need. This means that it's critical for healthcare professionals to be assessing and evaluating the risk of health decline in the caregiver. There are some limitations to this study. Our focus groups were held in January and February of 2020, prior to the COVID-19 pandemic, and the picture of caregiving has changed significantly since the pandemic. Therefore, a broader and updated iteration of this project is well warranted. Our findings present what a sample of caregivers in Saskatchewan want for support in their caregiving role. Saskatchewan caregivers reported their priorities are to receive clear and concise information on their role as caregivers, respite from their caregiving duties, and financial assistance. Emotional and informational support in the form of online forums, live discussions, seminars, workshops, and other educational opportunities are examples of programming that Saskatchewan caregivers would like to access. The perspectives of those with lived experiences provides essential information when directing intervention development and implementation, which holds true in the case of caregivers and support interventions. In Saskatchewan, the support network for caregivers is in its infancy, but turning to those with lived experiences can help to grow a successful program for residents within the province. Thank you so much for attending this presentation. I am also presenting another abstract on caregiver identified priorities in the late-breaking abstract section. Stay well and take care.